Oh no, it's been a good success, making sure that we've been able to fill the available capacity for testing. We apologise to the inconvenience of those who've gone onto the website and the test capacity that we've got had already been taken up. But yesterday I said that because there is this spare capacity, we can now offer it to essential workers who need it in the community. You can directly book. And thousands have taken that up.
When you look at the number of people being tested, 28,500 yesterday, are you really going to hit your 100,000 tests being carried out, not capacity, being carried out within a week?
Yes, we're on track to do that. And you say, the online system is in order to apply to go to the drive-through. So that's working. And as we've seen from the increase in testing just in the last 24 hours, that is going up sharply. Capacity went up by 10,000 and needs to keep going up by 10,000 a day. So we're on track. I know it's a very stretching target, and I know that people have been skeptical of our chances of hitting it. But and there's still a week to go. So, there's no guarantees in this world.
100,000 a day, that is not a wing and a prayer. That's going to happen. What about the Prime Minister's 250,000 tests being carried out a day?
Well, once we reach 100,000 tests a day, then we'll set out our plans. But step back on testing. The important thing is testing capacity is vital for patients, for people who live in care homes, exactly as we were talking about at the start, and also for key workers to make sure they can get back to work if they test negative and therefore they, the symptoms aren't of coronavirus, or if they test positive so they can get the right treatment. And the good news is there's been this massive expansion in testing capacity. And I went out and, put my 100,000 target out there. And lots of people criticized me and said that I shouldn't have put the target out or that I was inevitably going to miss it. And it's had this galvanizing effect of getting testing really, really going.
You've been talking a lot about testing and contact tracing today. Just take us through why now you're pursuing a policy that, against the advice of the WHO, you abandoned on March the 12th. Why was that abandoned?
Well, no, we've been expanding testing all the way through. In March, we started March with 2,000 tests a day, and we ended March with 10,000 tests a day. So we multiplied the testing capacity.
But you abandoned community testing on March the 12th. You gave up on that. Why?
Well, because we had to focus the tests that we had on patients, because patients are the top priority. So it wasn't that we reduced testing, far from it. We've been increasing testing all the way through. It was that we had to focus the tests that we had on the people for whom it was most important. And now that we've got the testing ramping up, whilst we've got the control of the virus, so the spread of the virus is flat, that means we can get back to the community testing, and we can expand it to all these groups who've so enthusiastically taken up the new booking technology this morning.
Let's talk about the other thing that you've been criticised about, which is the lack of protective equipment, PPE. When did you start increasing the order massively? Was it January when the first cases started to emerge in China, or the real shape of the crisis started to emerge? Was it February when we had our first cases here? Was it March when it really took off here? When did you place that first big upscaled order?
Well, we started with a big stockpile. And right at the start, it was clear that as well as using the stockpile, we had to replenish it. In the first instance, the big challenge is a distribution challenge. It's a huge logistical effort. The head of the armed forces said that it's the biggest logistical exercise he's seen in 40 years.
When did you put in that first order to replenish the stockpile that had been depleted?
Well, right at the start, we were clear that we need to do that. I haven't got the exact date in my head when we put the first order in, but that's been one of the strands that's been important throughout this. And the challenge we have right now as a country is that there's a global shortage of protective equipment.
Do you fear that that shortage has cost the lives of some health workers?
Well, that is a really important question. And you can imagine that as Health Secretary, I feel a deep responsibility to that. We do look into the case of each and every death of somebody who works in the health service, and we have not found that link directly in any of those cases. But of course, we learn the lessons from each one. Now, in some cases, of course, people who work in the health service have caught the disease outside of work, but in some cases, they could well have caught it at work, and I feel a deep sense of responsibility towards that.
And it's reported that over 100 frontline health workers have now died. Would you accept that that figure is too high?
Well, any death is a tragedy. We're dealing with a virus that is clearly has a bigger impact on those who come into a large dosage, and we've seen all the way around the world health workers affected and die. And it is a sad truth. It's part of the bravery of the NHS and all the people who work in it.
When you look at the problems over testing, the problems with PPE, the controversy over when we went into lockdown, do you worry that the government has been behind the curve from the moment COVID-19 started to spread so disastrously across the globe?
The two big objectives were, one, flatten the curve and make sure that we get this epidemic under control, and two, make sure the NHS is never overwhelmed. And on those two objectives, absolutely at the core of our policy, both of those have been met. Now, of course, that isn't to say that there are challenges. Driving up testing, which is now, has gone up by 5 times during the month of March. It's gone up by 5 times so far in April, and with the goal ahead. Of course, PPE is a challenge, but give credit to the team.
Do you accept in some instances that the government could have done better?
Well, we're all humans, but what I can tell you, Kathy, is that we get up in the morning and we do our very best. We do all that we possibly can to get this country through this in the best way that is feasible. We're dealing with an unprecedented crisis that has that nobody's ever seen before. We're dealing with an unprecedented crisis. We're dealing with a new disease that has some novel features which are particularly nasty, that countries across the world are doing their level best to deal with. And I think that actually the public understand that. And one of the reasons that the public have been so resilient and follow the social distancing rules with such a degree is because they can see that everybody's doing their best. And we learn, of course, and look around the world and learn from places that are doing well. We learn from places that aren't doing so well. And we're just constantly looking for how we can possibly give the best response we possibly can.
And just finally, you candidly admitted that you were moved to tears by the sight of 13-year-old Ishmael's coffin being lowered into the ground on his own without his family. How have you and your team, your officials, your advisors, made sense of the enormity of what you're seeing and the countless stories of personal tragedy?
That funeral, I just thought it was so awful. And in fact, we changed the rules. I went back in and said, come on, this can't be right, that people are interpreting the rules to say that a family can't be at a funeral. And we rewrote the rules and they were more clear. And I hope that's been able to bring some peace to people who are now at funerals now. But that was a terrible moment. And also, I have a 13-year-old daughter, and to hear that he died without his parents by his side. And we've changed that as well, because that was really terrible.
Matt Hancock, thank you very much.